An outbreak of Legionnaires disease in central Harlem, New York City, has grown with 58 people now infected, including 2 deaths. The outbreak first started just 2 weeks ago at the end of July, and health officials are urging residents in the area to watch for symptoms and reach out to their doctor immediately if they feel sick. Joining me now with more is ABC News medical correspondent Dr. Darrien Sutton. So, Dr. Sutton, what exactly is Legionnaire's disease and how do people get it?
Yeah, well, we see this time and time again. So this is a bacterial infection often associated with contaminated water sources, which is why we talk so much about these cooling towers. In New York City, not only is the population dense, but there are a tremendous amount of cooling centers. And unfortunately, some of them might not be well maintained or up to standards. And that creates an opportunity for this bacteria to multiply and transmit via water droplets and even mist to people who might be more susceptible than others.
So what are the key symptoms people should watch out for? And when do we know when this actually gets serious?
Yeah, this is what I talked to about with patients who are coming in concerned that they might be exposed. The symptoms associated with Legionnaire's disease are flu-like symptoms, cough, shortness of breath, sometimes even a fever. Really important to know here, this is not something that's transferred from person to person. It is transferred from exposed water droplets. But if you know that you've been exposed and you have these symptoms, fever, chills, muscle aches, you should talk to a provider because early intervention most often has the best outcomes.
Okay, so again, someone in the Harlem area right now, they think they have Legionnaire's disease. What's the first thing they need to do?
Number one, understand if you are at that high risk. So for example, adults over the age of 65, those living with chronic lung disease, or those who might be immune compromised. For example, those who have a history of an organ transplant. And then if you've been exposed, monitor your symptoms. If you start to develop symptoms, most often between 3 to 5 days after exposure, that fever, that cough, that shortness of breath, then you want to get tested. But if you don't have symptoms, you're in the clear. Most often, most people who get exposed do not get this infection. It's really just for the few who are susceptible and vulnerable.
So talking about the people who do get exposed and who do get those infections, who's most at risk for severe illness from Legionnaire's disease, and what do we do to protect ourselves?
Yeah, number one, if you have a history of a chronic lung disease, that puts you at an elevated risk. So you want to make sure that if you are in these areas where you have exposure, that you're being really mindful of your symptoms. And then again, if you have some level of immune compromise, for example, if you're getting cancer treatment or chemotherapy, that puts you at an increased risk. Those are groups that you want to make sure that you're paying close attention. And also, like children under the age of 5 can also be exposed to this. Now, if you are exposed, it usually takes about 3 to 5 days to develop symptoms. So if you're exposed, I would encourage to monitor beyond that for up to 2 weeks. If you develop symptoms, get tested, get treatment.
All right, Dr. Darrien Sutton, always keeping us updated. Thank you.
Of course.